Millions of listeners and televiewers, it is a pleasure to be with you today for this other edition of the program You and Your Health and on Equinoxe Radio Multimedia. After a very long break, we are finally back, and we are back with exciting health tips and how to better prevent some health issues. And to assist me on today's program, I have my co-host, Asia Luciliengo. Hello, Lucy.
Hello, Immaculate Fogwe. Hello, ladies and gentlemen. Thanks for joining us for another edition of the program. Like Immaculate said, You and Health.
It's been long, right?
Yeah, it's
Did
been
you miss
a while.
them?
I missed them so much. I couldn't just wait to be here again.
Okay.
Yeah.
We are finally back, and we are back with the best. As I said, today we'll be talking about a very delicate issue, and it's no other than cardiac arrest. Have you ever known someone who suffered from a cardiac arrest? How did you behave? Were you scared? If you were scared, then today is the best time to watch or listen to the program, because we'll be giving you all tips you need to know as far as cardiac arrest is concerned. Meet our guest in a few seconds. On today's program, we'll have a specialist. He's a cardiologist based here in Douala, and he's no other person than Dr. Cabral TANTCHOU. Hello, doctor. It is a pleasure having you on the program, You and Your Health.
Hello, Immaculate. Hello, Lucy.
Hello, doctor.
You're welcome.
Thank you very much.
Okay, doctor, it's been a long while, though.
Yes,
we are so
true.
happy to have you back in the studio.
Me too.
We are talking about something very delicate, and it's no other thing than cardiac arrest. Tell us, what should a layman understand by the term cardiac arrest?
This is really a question that is now popular. There are many people that have experienced that kind of situation in our midst. Cardiac arrest is when the heart stops beating suddenly. You see someone probably is just, usually people are just seated, or they are doing something, or they are happy, and suddenly they take a particular position and they see that they are just falling down, or someone that is just moving, walking, and suddenly he can lean on someone saying that it's not fine, or someone that is shouting, and suddenly he just falls down. Yes, these are cases that we should suspect, or these are cases that are clinical manifestation of cardiac arrest. The heart just stops pumping blood, and you know that is blood that is keeping us alive. Why? Because blood carries oxygen, it carries nutrients to the system. And when blood stops going in our system, is when oxygen also stops, and you fall, you collapse. And when you are collapsing, you become reactive, and also the breathing also can stop. That is what is really called sudden cardiac arrest.
And what can trigger such a condition?
Many things can trigger that condition. The main problem is that usually we Cameroonians or we Africans, we are not sometimes conscious about our health condition. Palpitation, someone that is having palpitation should come and consult, should come really and see the cardiologist to know what is going on with his heart. Not to talk about congestive heart failure, not to talk about hypertension, not to talk about other diseases that can bring to that problem. What I want to emphasize on is that when you are not feeling good, or you slept and the next morning you are having headache, or you are having a particular problem, it's better to draw attention of the medical personnel.
Doctor, you made mention of palpitation, headache. What are some other signs and symptoms that if you have, you should be able to visit the hospital?
Very, very important. Mainly when we are talking about palpitation is the most problem, sometimes that people will just take it for granted. Palpitation is what is when your heart is beating and you feel it and you hear it. Some mama will say that it's like they are pounding a choke. Some other people will say that it's the heart is making inside pop, 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 pop. Some other people say the heart opens, something like that. Each person is having his way to describe palpitation, but your heart is beating. Sometimes it can be fast, sometimes it's slow, and you feel it. And when you are feeling it, it's better really to draw the attention of the medical personnel, a cardiologist precisely. Let us do the EKG. Let us check your heart in the machines and see what is going on to prevent that kind of condition. Because there are some people that really are asymptomatic. They are having problems. I'm saying that really serious problem of the heart. It can be dilated cardiomyopathy with low ejection fraction, but they're not symptomatic. They are that group of people. There can be people that have that underwent myocardial infarction or cardiac attack. And they will not know. They will say, I'm having epigastric pains, and later on they take some kind of medication, and with time they don't feel any problem anymore. But the heart is bad. The heart is not functioning well, and they will not know. And a particular time they will have those palpitations, they will take it for granted, and later on that one can fasten or can bring that cardiac arrest. Not only that, you know, here in Cameroon, there are people that like some type of emotions or recreative medications. Yes, those things, concoctions. We're talking about concoctions. Sometimes we don't know the contents, the ingredients. Concoctions also can foster that kind of problem. Many other conditions, renal impairment, congenital heart diseases. Like not long ago, we saw a gentleman that came to consult, and when you check the heart, there are some really, when you are a doctor, you see cases, and you see, sometimes you ask yourself, how can this man be so fine with this problem? And if he falls tomorrow, they will say, oh, he was fine. He didn't have any problem. He just felt, and that was all. No, he had issues, serious issues, that he was not following up, or he was not taking medication, or he didn't consult for that. We used to call them moving corpses. There are many moving corpses. Moving corpses. That's why I used to say to people, if you are passing someone and someone is harassing you, or someone is making you angry, don't put hand on him. Don't. Yes, you can just put your hand on him like that, and he falls, and you are the one the cause of his death. Meanwhile, it was already a moving corpse. The heart was bad. He was having kidney failure. He was having many dilated cardiomyopathy with low ejection fraction, end of stage of a particular disease, and you will just take him, and you now will be the problem.
And now, doctor, when someone suffers from a cardiac arrest, how can me, who is beside him or she, save the person's life?
That is a very, this question is very, very important. Why? Because we need practical skills. We need something that people can learn and help better the person. Lucy, it's really complicated to say it. It's really, we should educate our population, and let me try to say it. Why? Because in other countries, probably in Europe, in US, you say call this number 999.
Yeah,
call
sure.
the SAMU, call this, and how you can call the SAMU, but you are far in village, in a suburb of village where SAMU cannot reach.
Exactly.
You do how?
On time.
On time. You say on time to reach step, not on time. I'm saying that to reach, because the road will not permit him to reach, not to talk about on time. Yes.
Yeah.
And again, really, the person should come on time as soon as they call. Something like 5 minutes. The patient should, the car should be there in front of your house, or they should come and help you. What should you do? What is very important is not to be afraid. Yes, the patient felt. Yes, it's not something good, but you should really, in brackets, gather yourself and put the person on a hard surface. Of course,
like
usually you say
cement,
that.
Doctor,
Yes. Because what we should do is what the CPR, cardiopulmonary resuscitation. That's what you should do. Without CPR, because the heart stops beating, and if you stop beating, you should help the heart to start beating back. And now the timing is very crucial. If you are waiting too much, it will not be effective anymore. That's why it's important to react immediately after. You put the patient on the hard surface. Probably if you're having a belt that is really too tight, you untie the belt, and you start, if he's having things that are blocking his mouth, or he was eating, probably you can remove what is there, and you start with cardiopulmonary resuscitation. What do I mean by that? You should press on the chest at the level of the nipple. You press 20 times, deep. You should be pressing deep 20 times, and mouth to mouth breathing. and you breathe in his mouth. You press again, you breathe. If there are 2 people, it's better. Of course, if you are having a go somewhere there, all those things, hygienic, to prevent this type of infection, that one will be good. Yeah. Infection, that one will be good. It will be good. Yeah. Yes. And you press.
What part are you pressing? The chest?
The chest.
Okay.
The chest. You press deeply. You put your hands, you press deeply 20 times, and you breathe in his mouth. 20 times you breathe in the mouth. Meanwhile, you are calling already for help. Probably you call a bike, a taxi. In our context, it's really complicated.
It's very complicated. So, doctor, for someone who has once had a cardiac arrest, what are some of the lifestyle changes they need to adopt?
If you had it already, it's very, very important again to come and consult to see a cardiologist. Yes, there are some tests that should run, because you can have a problem with the muscle of the heart, with the conduction system of the heart, like a long QT syndrome. You can have hypertrophic cardiomyopathy. You can have Brugada syndrome. These are things that really can give that kind of condition. And if it's the case, if they are seeing those problems, you can benefit from a defibrillator. A defibrillator is what really, instead of shocking your heart, they implant in your chest. And when that kind of rhythm starts, what brings mostly cardiac arrest is what? It is a particular rhythm of the heart that is too fast. It's called ventricular tachycardia or ventricular fibrillation. It's too fast, the ventricles are beating too fast till oxygen cannot reach your brain anymore. And in that case, you should really shock the patient. And that shock usually brings back the normal activity of the heart. And implanting that, when there is a lead, when the lead will sense that kind of activity, will send that shock on your heart, and you get back to life. And those things can be implanted here in Cameroon. That's why, yes, you can do that. That's why it's very, very important. If you survived, it's very important to come for those tests. Let us check your heart appropriately, correctly, and correct whatever is happening. It can be a problem with electrolytes. It can be a problem of hypertrophic cardiomyopathy, like I said, a long QT syndrome. It can be dilated cardiomyopathy with low ejection fraction. It can be hypertension, and the muscle is already too big. It can be, and again, if you see that, because you drank a concoction, you should stop that. Yes, that's why it's important for the person to come, and we should do investigations and see what is going on. But usually what brings the problem are complications of some cardiovascular diseases. That's why you should start with the prevention of cardiovascular diseases. What you should eat less salt, you should stop Maggi, you should do physical exercises twice a week, you should stop alcohol, you should stop smoking, you should eat much fruit and vegetable. The meat that you should prefer is white meat. You should avoid stress. These are the tips really that each person really should follow every day, really, to avoid that kind of condition.
Now, is there a possibility for someone who once had a cardiac arrest to have another?
Definitely. It's like if someone is having Brugada syndrome or long QT syndrome, or you are pricking yourself, pricking, or you are drinking. Okay, this time you were saved. You go and you
come
drink.
back. Okay.
Definitely you will come back. Definitely you will come back.
Okay.
And again, if you are doing it, it means that you too looks like a dog. I don't know. You want to commit, yes, or you want to commit suicide.
Okay.
Yesterday, I saw a lady that came to consult, and I said, wow, because she knew everything about prevention, her medication, how she chooses to take the medication, the side effect of the medication. I just said, wow, this is nice. He said, no, doc, I want to live.
Okay.
I want to live and see my children's children.
Consciousness. She's conscious.
Yes.
Of course.
Very, very important. We should be conscious about our health condition.
Exactly.
Okay, doctor, is there a similarity or are there similarities between a cardiac arrest and a heart failure?
Heart failure can bring cardiac arrest. Heart failure is what is still a condition when the heart doesn't beat sufficiently to meet the requirement of our system, or probably is too dilated, that is not pumping enough blood, enough oxygen for our system, or is too stiff to receive that kind of blood, or probably there can be a problem in the blood that brings those complications. And mostly heart failure brings cardiac arrest. Why? Because let's take the person, a patient with dilated cardiomyopathy. The heart is so thin and dilated, big like this. And when it is like that, there's a problem with the left ventricle, the muscle of the left ventricle, and many ectopic beats can organize themselves. Remodulation of the left ventricle, and many ectopic beats can organize themselves in the left ventricle and bring that kind of arrhythmia, that kind of heart rhythm that is too fast, and the patient can die. And not only that, there are other many, like a patient with mitral valve regurgitation. When you're having mitral valve regurgitation, the atria, they are becoming dilated, the ventricles becoming dilated, and there can be atrial fibrillation. And it can go so fast that you die too.
So, doctor, can we say that the cases of cardiac arrest, they are increasing or decreasing in Cameroon, considering the patients you receive in hospitals?
Concerning the cases, you know that last year I was still here in Equinoxe, and there were so many people. He died, he was doing this, he died, he was doing that, he collapsed and he died, probably because of now the awareness of media that we are having, or we are talking every day, sensitizing population about these conditions. Probably that's why that we see many more cases. Probably in the past, we could have said it's witchcraft.
Okay, doctor, whatever. We'll come back. I think it's time for us to start receiving calls from our listeners, because that's why we are here, to educate them on some health issues. So to be part of this program, you can call the following numbers: 670 54 70 49. I repeat, 670 54 70 49, or 656 62 22 22. 656 62 22 22. Those are the few numbers you could call and participate on today's edition of the program, You and Your Health. You can go back to your questions.
Yeah, doctor, we're talking about the increasing cases. Can we say they are decreasing or increasing?
It is increasing. It's increasing. Because you see, and again, a group of and as far as that disease is concerned, cardiac arrest is concerned, it really affects each person. Because sometimes you can be thinking that it's only poor people that can get the problem, or rich. No, or I'm poor and rich and children and old. I'm saying that every single person is concerned with this problem. Every single person. In children, they can have congenital heart disease. You see a child playing, or a child going here, going there, you think that the child is fine. Meanwhile, it's not. That's why it's very important. Sometimes there are some, when they are coming, they are asking if the child can go to school. I usually say that if the school is near, yes, he can go. Or if really there's a bike or something that can help him to reach school, it's good. Because if he's trekking, children, they like playing. He can be thinking that he can do this, he can do that, he can do, and he starts, and that will be all.
So, doctor, if we are saying that the cases are increasing, which is a predominant factor? Is it stress, or is it what we the intake or what we eat? What is the predominant factor?
It's a bit complicated to say the predominant factor. It's very, very complicated. But we know that hypertension is the main cardiovascular disease that we meet in Cameroon. And probably with that disease, related stress too, because hypertension, stress also is involved in the risk factors, and also stroke really can bring cardiac arrest. Yes, ischemic or hemorrhagic.
Now, after highlighting all of this, we are left with some few minutes. Tell us, how can this condition be treated?
Cardiac arrest, the way this topic is really
it's vast.
It's vast.
And the way he masters
no, it's vast. Treated, of course, if using the CPR.
Wow.
Yes, you have been resuscitated. Let us say, yes, it's really resurrection. Yes, because you died. Yeah, and you came back. That's it. And usually, and later on, there can be some mental problem after. There can be some cognitive problems.
Wow.
Yeah. It's sometimes complicated, to manage someone after that type of condition. But if we see that kind of problem that can bring to that, it's important to come and we can insert or implant a defibrillator. Some medication can be prescribed that really will suppress that kind of activity of the heart, or prevention of the problem, like those drugs that people can take, concoctions. That's why all the time we are coming say that concoctions, this and that and that and that. Don't take, because we know what they can bring.
Lucy, I'm sure you would like to know how much it can cost for someone who has had a cardiac arrest. You'll be talking about implants and all of that. Want to know how much can it cost? Yes, it's very important, because from what I've heard, I want to get it from the horse's mouth.
Very, very important. In Cameroon, preventive measures are very, very important. Yes. Preventing medicine is very, very important. We should not reach that stage. Anyway, if you are born with long QT syndrome, or if you are born with Brugada syndrome, or you are having ventricular tachycardia, something like that, or you had heart attack, yes, you need an ICD. It's a defibrillator that is implanted, and it costs something like 8 million.
Okay, Lucy, with this our economy, you know how it can be.
I'm sure some people will just be like, it's preferable I just die.
And that's it. Actually, when someone comes with all indications, with everything, the ECG is confirming, the cardiac ultrasound is confirming, everything that we did is confirming. When you talk about the implants, say, oh, let me die.
But doctor, I think there's a very big problem there, because what about the common man who is unable to even pay just transportation fares, unable to feed? We see how life is changing in Cameroon. Things are very expensive. How can a common man afford 8 million? Is that not like sending the person to an early grave?
Of course.
Okay, our technician is already, but just give us your last word to people.
Your advice.
Preventive medicine is what we should do in our setting. And if you are not feeling comfortable, if you are having a particular problem, come immediately and consult.
Thank you so much, Dr. Lucy. Any last word?
Well, health is wealth. We should stay healthy, even though it's not easy. We should go to our doctors for consultation.
Exactly. Yeah. Health is wealth. And that's what put an end to today's edition of the program, You and Your Health, aired on Equinoxe Radio Multimedia. For presentation, we were Asia Lucy Liengu, myself, Immaculate Fogwen, as I had as guest, Dr. Cabral TANTCHOU. Have a wonderful day in the company of more interesting programs on Equinoxe Radio and, of course, television. So long.